Hello, my name's Carol. I'm a primary care nurse based in Gloucestershire, and I'm the executive chair of the Primary Care Respiratory Society. Lung cancer is a really scary thing, and I realise that a lot of people are having problems accessing their primary care practitioners at the moment. So I'd like to just give some advice on probably the best way to navigate the system. So I think the first thing is to be persistent. So it's very easy to request an appointment to be brushed off and feel that's the end of it. It absolutely must not be the end of it. So it is for you as the patient to make sure that the person you're talking to realises what the problems are and that they are persistent and ongoing, and not to brush everything aside to COVID at the moment. And I think linked in with that, it's about actually explaining what your concerns are, and saying the words, "I think I might have cancer," are really hard. But if that's what you think is happening, it's really important that you tell somebody that's what your fear is, and then you'll be taken more seriously. I think the other thing is to think about follow-up. So if you're expecting follow-up, be that an appointment for a chest x-ray, the results of some tests, a follow-up phone call from your GP, if that follow-up doesn't happen, then take it as your responsibility to follow that through. And that may mean calling your practice, it may mean calling the hospital for a chest x-ray appointment, but it's only too easy to get lost in the system, and you don't want that to be you that is lost in the system. So if you're expecting appointments, you're expecting phone calls, you're expecting results, and you don't get them when you think you should, be a nuisance, be persistent, and actually talk it through. I think it's really important to realise the pressure that GP surgeries are under at the moment. So we've been through a really difficult time. We've all had to learn to work differently. Primary care works as a small business. So if you have 1, 2, or 3 members of staff that are unwell or that are self-isolating because they've had a positive result, there's no redeployment, there's no backup staff. So that just leaves the team wholly depleted. So they are sometimes slower at responding than they think they should. And it seems to me that every practice has a different way of making appointments. So where I'm a patient, I have to do an e-consult. So I have to type everything in first and then wait for the surgery to contact me. I know other surgeries you can ring and get through. So you need to know what your system is, and you need to follow that system as closely as you can. But when the system lets you down, call the surgery, talk to the reception staff. They're usually really nice people that are there to help you. Ask to speak to your clinician, and if that's not possible, make an appointment to do that. And then don't forget that if things really aren't going the way you think they should be going and nobody's listening to you and you're not getting an appointment, it's worth asking about the practice complaints policy, because actually sometimes you do need to escalate these things to be taken seriously and to actually make things move. And all practices have a complaints policy, and they should respond to complaints very quickly. And if they pick up a clinical concern, then they will be very hot on that. So those are the things I would recommend. I would say bear in mind that a general practice has between 8,000 and 15,000 patients. And if a clinician's spoken to you and maybe 20 or 30 other patients that day, they may not remember the detail of that conversation, and something may slip through the net. So as I say, it's your responsibility to follow that through. Be a nuisance for once. You know, we're all too nice, all too good at being polite and nice, but when our health is at risk, time really is of the essence. So be persistent, be polite, but actually make sure that things are followed through.